Hi, my name is Dr. Ilya Benjamin and I practice in Las Vegas, and today I'm going to share with you how we place a dental implant using virtual software called ExoPlan. You see, sometimes when a dentist needs to place an implant in a tight space, we can't really do it free-handedly. We need to utilize a software. Today's case was a little bit of a surprise because even though we used the surgical guide from the software, we had something that came to us at the end of the surgery, and I'm going to share that with you how we solved it. So our point to you is sometimes you could be ready for things in life, but it may not go the way you plan it, but at the end you have to have the skill set to solve all the equations, and I hope you enjoy this. Bye-bye. Okay, so here we have what we call the CAD/CAM software, where you can see the implant, the guide, the sleeve, and we're always turning it from different angulations to see how things are going to fit in the mouth and the trajectory. Now we have combined it with a CAT scan, which is 3D imaging, and this is a side view and coronal view, and you can see how close the adjacent teeth are as we are manipulating the program. We're trying to see how the crown is going to fit in between and also choose the right implant library, the length of the implant, and also the shape of the implant, which changes by width. So as you can see, again, that's where the implant is located, in between the teeth, and how the crown looks. At this point, we're looking at the fit of the guide. As you can see, it's passively fit. And these are the spoons that we use. Inside the guide, there's a sleeve. And I'm showing you that the spoon goes in there, and also the drill. And the drill, we're testing it out. We always print two guides, and one of the guides, the sleeve didn't fit snugly, so I'm showing you the one that it fits snugly, but the other one does not, so we're going to use the one that fits snugly. We always print two just to make sure that this is precision driven and the trajectory of the drill is going to be correct, because if it is off by even a millimeter, that the implant is going to go the wrong way. After the local anesthetic, we tried the guide again, fits in. Here comes the spoon on the right sleeve, and this is again the drill that goes in, up and down, and allowing the spoon to guide it in both the X, Y, and Z axis. Now we're going to the next drill, and it's a sequential expansion of the drill set. The spoon size also changes. And remember, these drills, they control the length, how far deep it goes down, and how wide it drills. So we can safely place implant with the guided surgery because we have virtually planned the case. And also, as you can see, we did not flap anything. Now I'm placing the implant. So here's a surprise. The implant is not going in the way I like to feel the insertion. So I'm going to remove it back and forth, and I'm testing it out. If I'm trying to see if the trajectory is good. And again, remember, this is all done flapless. We're not releasing the gums, and I see that the implant has not gone all the way, so I'm going to back it out right now. Okay, I'm backing out the implant, and I'm deciding to drill further, and sometimes we do this without the guide because we already have the path of the trajection. And what you'll see is I'm going to try the implant placement again, and it does not go all the way down to the length I want. So an executive decision has to be made to remove the implant. That's what I'm going to do. I'm going to reverse it out, And this time I'm going to open up the gums. That's what I'm doing right now. I'm opening up the gums, and we are going to expose the jawbone to make sure that we're seeing the path of the trajection. So as we're doing that, we are going to allow for another drill to go in there, but now we're visualizing where the bone is, and that's what I'm doing right now. I'm going to go with a final drill, as you can see, in the right trajectory, and we're going to go to the working length, and now we're going to go with a second drill to allow for the width of the implant. And remember, we're doing this in between the two teeth safely. The trajectory was defined by the CAD cam, and now we're trying to put the implant, and we want to widen it up a little bit so the implant goes in there without any stress on the jawbone. Again, the width is increased a little bit. These are really hard implants to place because you're trying to safely place the implant, not disturbing the adjacent teeth. So now we're going to tighten that implant in. As it goes in, it kind of disappears and seats right at the length that we wanted. And as you can see, the implant that is exposed, the surface, we got a good torque there. Now, whatever is exposed, we're actually going to cover it with what we call bone cement. And you're going to see a white powder that after we clean around the area and prep it, we're going to cover it up with a cement that basically turns into jawbone, and we'll cover that up with the tissue and stitch it up. So as we're cleaning things up around, we are ready to squeeze that powder in there, and that is the bone cement that goes on top. As you can see, we're going to form it. It's like a putty, and then with a wet gauze, it turns into a solid. Okay, this is a special bone that we use, and at this point we're going to stitch everything back, and what you'll see is that the gums will cover the bone and the implant, and that way it's preserved and there's no infiltration of saliva there, so the bone can heal, the implant can integrate. And now we're going to show you at the end what it looks like. A couple more stitches to go, but we're just showing you at the end. I hope you've enjoyed this presentation.